talk on the low back pain. I will try to introduce all about the lumbar spine. I'm with Eleonora, a model that she will help us to understand something more. Now please, you can lie on your stomach, so face down. I already painted a lot because we finished right now another video introducing the cervical spine. Now you will see the thoracic spine and then finally our lumbar. So to find the L1 we need to check all the ribs, so I can find here the ribs, and we will find the last two ribs, so on the lower side of the thorax right here, and then if I go upward I will find the last thoracic vertebra right here, so the T12. Then I will go down and I will find finally our first lumbar vertebra, so L1. I can touch here the spinous process. Here we have the transverse, and right here I will check if I want to be sure of the landmark. I will find the last rib. So right here the last rib, here 12, and finally the L1, so our first lumbar vertebra right here. I can move comparing with the other one. For example, the lower side we find the other vertebra. Then I will check the L2, L3, and finally L4. When I want to work on and I want to find, to spot the fourth vertebra, the lumbar vertebra, it's very common to find and follow here on the iliac bone, all the iliac bone, and then when I arrive right here, I make a line. So on the height here of the iliac bone, I make a perpendicular line right here, and I will find the L4. To find L5 is very easy because I go a little step down and I found the last vertebra, because on the lumbar spine we have 1, 2, 3, 4, 5 vertebra, and to make an idea we have the green side, so you can see we have the cervical spine, so on the violet right here, purple, and then we have the blue side, so the thoracic spine. We have 7 vertebrae here, 12 vertebrae here, and then the 5 vertebrae of the lumbar spine on the green side. So we find the L1, L2, L3, L4, L5. Okay? And then when we arrive at the lower side, right here, you will see right here, we have the orange side. So we have this triangle that, like the bikini, is the sacrum. So we will find the upper side of the sacrum, and then right here, the lower side of the sacrum. To make an idea, I can move this, and here, on the same way, I can move the sacrum. The limit here, the borderline between the sacrum and the L5 is the lumbar sacrum joint right here. Okay? So when we want to see the anatomy of this side, we have the vertebra with this position, so you can see here the L4 and here the L5, and you will see we have this spinous process, that is the spine we find right here, the first part we can touch, and then on the lateral way we have the transverse process, so this side that we have on the lateral side. Okay? Now, after the anatomy, it's very important to understand something about the physiology, so the way this vertebra has a function, so the way they used to work, so they can make some movement. We will see how we can make, for example, a flexion of the vertebra. So you can bend in front of you, please bend forward now, like this, okay? like this, perfect, good. You can go down also with your head, good. And we will see, we can make right here the flexion of the vertebra, okay? Now you can come back, please, and now make a little extension, okay? Yes, backwards. So in this case, we make a posterior compression because we will make an extension. Now it's very easy to make, for example, you will make right here a rotation just of your body, okay? So stop your, stop your iliac bone, the ilium, yes, the pelvic, and then now the pelvis like here, okay, and you make a rotation. So on this case, we make a rotation, okay? And now the last part, we will make a bending. So this side bending is very important because we will do this kind of movement between two vertebrae, okay? These are all the movements of the lumbar spine. And we will make an important test now to check the iliac bone on this side. So we are right here and right here. This test is very important to find if I have some locked joint on, for example, the right on the opposite side. So please bend forward, yes, okay. And I will compare which side is going upper than the other. And in this case, for example, I will find something right here. You can see this thumb is higher than the other one, and I will check the difference between these 2 points. Okay, this is the first important orthopedic test. Now, please, you can lay down, face up. Okay, and we will make an important test to check. So we have on the test the right iliac bone locked, is stopped, comparing with the other one, and on this case I will find that this side is forward comparing with the other one, so it's anterior with comparing with the other side. If I make a rotation, in this case of the iliac bone, I will show you. If I make a rotation of this side, so the iliac bone is this white side, and I make a rotation, if I make the rotation, I will make an increasing of the length of this leg. You can see, so this length of this leg, it will be more than the other one. So I usually make a comparing test again here, and I will see that this ankle is more length than the other one. You can see?
It's longer, yes.
It's longer. It's more long than the other one. It's longer, right here. At a different length, okay? So, now it will be very important to make the adjustment to make shorter this leg. And it's very important for postural notions, because you can come again here, please. Stand up, please. If we have a posture, this leg is longer than the other one, we will have a compensation of the body, okay? So, to put in a good posture, I need to correct, to start the iliac bone. So, the most important step of our spine. And then I will work on the spine. So, please, you can bend again. Okay, thank you. And I confirm this problem. So I will work on this side of the iliac bone, and then I will correct the L4 and L5 on the opposite side. It's very important to discuss about the posture, because postural conditions are generally the cause of, for example, some hernias or discopathy, like protrusions on the spine. So some compression, if we see that this is the disc, and this is the vertebra on the upper side and the lower side, we make this kind of compression. So we have to make a decompression of the disc, and I will show you how. So you can lay on your back, please. We will make this leg shorter than the other one. I prepare everything for the treatment. Don't help me. Good. Relax. Drop your legs. So this is the problem. We have this rotation of the iliac bone that make longer this leg. Okay? Now I need to reduce the length. So this is the contact. Relax. Don't help me. I'm here. Okay, on the iliac bone. Drop your body. Good. Okay, relax your and release. Yes, relax, don't help me. Perfect. Are you okay?
Yeah.
Okay, this is the first part of the treatment. Now I will check again the length of the legs and relax, don't help me, and you will see in few seconds, look, in few seconds we have the same length. You can see here the red mark like here. Okay, same length of the legs, and in few minutes it will be improved more because we will wait for the new adjustment of the muscle too. We will work finally on the lumbar spine, so you can turn on this side. Okay, you can lengthen your legs. Good. Don't help me. Perfect. The contact is right here, so I found something right here. So we are not on the L4, L5, but we are on the L1, L2 right here. So we will work on this side. Okay. Don't help me. I prepare everything for our technique. There is no pain. It's a very gentle technique. Safe. Now take a breath. Okay, inhale, exhale, relax. Yes, drop your body. Good. Perfect. Very easy. Face up. Good. And now I will check also the psoas muscle. No problem here. We will make a little exercise, stretching exercise, and now there you can check again here. You can see, look, absolutely the same length. Can you see? Okay, I'm not correcting, just pushing, and you can see we are on the same level. So a good job for postural goal and for our lumbar spine. Sometimes we have some problem also on the sciatic pain. So please, you can turn on the other side, face down. When we have our column right here, you will see. Remember, we are on the green side and the orange side. Between the green and the orange side, we have this yellow side. You can see the structure is the nerve. Okay, this is the first part of the sciatic nerve. It's a very big nerve. Okay, so we are right here. This is the side when we start to have the first line, so the first root of the nerve, and the sciatic nerve go downward following all the side. Okay, towards all the leg, passing here, and it will go down towards the ankle, toward the foot. Okay, so we can feel, because of a compression here on the lumbar spine, some pain going down on our leg and going down to our foot, toward our foot. Okay, so it's very important because this is the sciatic. It's the sciatic pain. It's very hard pain. we already worked on the first root of the sciatic pain. So we already worked on the iliac bone. Now we work on the first root of the sciatica. So we worked on the L1, L2, L4, but especially L5 right here. And generally we make an important test for the piriform, that is another, piriform is another important muscle where we have the location of the sciatic here, the sciatic nerve right here. And if I start to do this, where do you feel pain, Eleonora? You can touch with your finger, yes, right here. Okay, this is the sciatic pain. Okay, so I will make a stretch like this, just a normal stretch, and then you will feel a relief, okay, after this stretch, because I can make free your nerve. Okay, very important. About the psoas, it's very famous muscle. You're an athlete, so for a sport woman like you, it's very common to work on a psoas muscle. We have this side where we can feel the muscle, and then a contact right here. So we will make a stretching again on our muscle. So you can come on this side, so stay on the edge of the, yes, stay on the edge, perfect, don't help me. I will fall down with the leg and just make a stretching like this. Very important stretching. Then I will back right here, okay, and make a technique on the other side of the muscle. Yes, it's not a pleasure, but you try to resist, okay?
Yes.
Okay, so inhale, exhale, good. Inhale again, good. One more, okay, one more, and I will make a, wait, good, a recoil right here, okay? So very easy technique to release the muscle, very easy. You can sit on this side, make a good job, okay, because we work on your sciatic pain, we work also on the lack of balance of your posture. Now is everything okay? You can stand, and we will make again the test. So stay like here, perfect. You remember we have stopped the area on the right. Now you can go down. You can see, 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 and we have a perfect line. A perfect line. You remember here there was an important difference. Now we have a perfect line. So let's check again so I can show you. Bend again, please. Perfect line. You can see. So we make a good result on our spine.
Thank you.
So you're welcome. Everything is okay. Thanks to our model, because she helped us to understand something more about anatomy, physiology, pathology, and our treatment. Hope you enjoyed the video. Bye bye.
Bye bye.
Thank you. Bye bye.